Okay, this is the HCPCS Manual 2016 Professional Edition. It's okay if you have the Standard Edition. That's okay. This is a Level 2 National Manual. Your CPT is considered a Level 1. If you look inside the cover of your CPT, you will see Level 1 and Level 2 here. And so now that's what this means. We're kind of filling in some of the puzzle pieces. This HCPCS manual is for Medicare and Medicaid patients primarily, although any patient may get their drugs out of here, get their durable medical equipment out of here, their supplies out of here. But in theory, if your patient is a Medicare or Medicaid patient, you need to try to get the codes from here first. If you can't, then you default to the Level 1, which is the CPT. There's only a couple of things that I tab in here. These first few pages will kind of help you with the symbols and the conventions within the HCPCS. Then you have your different outpatient prospective payment system information, which might be helpful. From a billing perspective, that information is in here. You do have several pages of pictures. These pictures might help you on the board in the medical terminology section. I find myself referencing the pictures some, just in general. The first place I tab is the index. The index within the HCPCS manual is more user-friendly. It's more like a normal type of index, not what we've seen in the CPT manual. It's just alphabetical. The next place I tab is the drug table. In this drug table, you will see all the codes start with a J. Most of them. There's a couple of them that don't. This is where the majority of your drugs are found for any payer. If you're responsible for coding for drugs that are administered, this is where you're going to find it, regardless of the payer. You have to pay attention to the dosage. You have to know the dosage given that you're coding for. The method of administration, it can be IV, IM, which is intramuscular, could be inhalation, could be oral. So you have to see how it was administered. Most of the drugs in here are going to be generic names. There's a few brand names, but most of them are generic. So, sorry, I think my coffee went down wrong. If we go to, I'm seeing if it's in here first. Acetaminophen. That's actually Tylenol. Acetaminophen is the generic for Tylenol. You can see they're not going to have oral in here necessarily for everything. They're going to have more of a professional level of administration. So for the acetaminophen or the Tylenol in this HCPCS, it'll be 10 milligrams IV, so the code would be J0131. In addition to the substance, which this is a substance, you would need to get your administration codes out of the CPT manual. So again, you would have two codes. Okay, so that is the drug table. In my book, it's all the blue. Whole thing is blue. Then starting on page 94, and if there's a tab more important, or the most important tab in this book, it would be this one. I'm telling you, no lie, when I took the board, I searched literally 5 minutes for these dang modifiers in here. So that's the first tab I put in here. So these are the HCPCS modifier tabs. We've had a few of these in the front of our CPT manual as a cheat, but this is the full version of them. And you may have to come in here and reference them during your board. They are all alphabetically ordered. Okay? Then we start the actual HCPCS manual, actual codes. And you will see along the side here, it tells you what your specific areas are. So it starts out with transport or ambulance services. Okay? And from there, it goes right into medical surgical supplies. Every kind of supply you could think of. For IVs, incontinence, dialysis, wound care, everything is in here. Ostomy supplies, urinary supplies, just everything you could think of is in here. Miscellaneous, different tapes. Then we get into, and I'm going to kind of move on, and you can see there's just dressing, there's just all kinds of stuff. Then you have different compression stockings. This might actually be for your heart patient. They have to wear those TED hose for so long after their surgery. A little bit of wound care. Then we go into respiratory therapy. This would be masks and tubings and machines, all of that kind of stuff. Helmets, this could be very much for your epileptic, severe epileptic, or different kind of disease process folks who need to protect their head. Then we have administration or administrative and miscellaneous. This is just kind of a catch-all. Then we go into our next section. All of these started with A. Now we go into B. These are enteral and parenteral. So enteral means the GI system, the intestines. Parenteral means outside of the intestines. So parenteral may be IV, that kind of thing. So it starts with parenteral. Your total nutrition, TPN stuff will be in here. Total parenteral nutrition. Then we go into some outpatient payment system areas. And I'm not getting too much into any of this. I'm just giving you an overview. You do not need to memorize this stuff. For the purpose of the board, you'll have 8 or 10 questions with the HCPCS, and it probably will be the easiest section on the board, one of the easiest sections on the board for you. They are not tricky. They're very straightforward. As you see, everything starts with a letter in here. Do not get that confused with the ICD-10 manual because it starts with a letter too. Didn't used to, but it does now. The ICD-9 didn't, but the ICD-10 does. Your next section, starting with the D, are dental procedures. You do have, if you end up coding in the dental area, there is a manual called the CDT, not CPT, but CDT, and that's the current dental procedures. So these are just a few geared toward your CMS patients. Then starting your E-codes, this is durable medical. This is going to be canes and crutches and wheelchairs and hospital beds and decubitus stuff and walkers, and I mean anything you can think of, it would be in here. Durable medical equipment, which is a very viable area that you could find a job and code from, is in the D&E field. So you would really get to know this area. The next section are G codes. These are temporary codes or professional codes. Some of the most common codes in here are some of these very first ones. For your Medicare patient who gets a flu shot every year, there it is, the G0008. That's the administration of the flu shot. Then you would go to the CPT manual and get the actual flu substance. Same thing for your Medicare patient who gets a pneumonia shot. G0009 is the administration of the pneumonia shot. And then you would go to the CPT manual and get the actual goop or the substance. Cervical screenings for your Medicare patient, prostate screenings, colorectal screenings, very, very common codes in here used for your Medicare patients. There are some physician services in here. These are generally either for recertification in home health or for also your mammograms for your Medicare patients, or for different physician services, or for their yearly Medicare services, their exam that they are eligible for. IPPE, those exams are in here. And I'm trying to kind of get, these are all G codes. Then you have H codes. This is for behavioral stuff. Again, very much geared towards your CMS patient. J codes. These are all the J codes from that drug table, just kind of written out. Okay, so this is kind of a double. Chemo drugs in here as well. Your K codes. These are temporary DME codes to a regional carrier. So you might not ever get in here. The regular DME codes we've already covered. These are just temporary codes. So if you worked in the area, you would know to go there. Your L codes are your orthotics. Different devices that help you stand right, keep your ankle straight, keep your knee straight. Inserts into your shoes because of issues there. All of that kind of stuff is in here, is your orthotics. Then you have your prosthetics, still L codes, but they're orthotics and then prosthetics. This is if you're missing something, like this patient's missing part of her foot. So she would have special shoes made. After prosthetics, you have just a couple of weird M codes. Then you go into P codes. These are lab tests. So you might, on your CMS patients, have to pick up a couple of these codes depending on, like here's a pap smear for a Medicare patient. You couldn't use the regular pap smear out of the CPT manual. You would have to come and use this one. And then these are different temporary codes. They change every year. I wouldn't get too heavy into any of those. Just giving you an overview of what's in here. Then you have your private payers at the back of the HCPCS, or your private payers. Private payers as in commercial. I mean, they're private payers as in not CMS, Centers of Medicare and Medicaid Services. Okay, there's a few temporary for Medicaid. These would change. Again, if you routinely billed for Medicaid, you would get a really good understanding of these codes. Vision services, these would be for your frames, bifocal glass, plastic, whatever, intraocular lenses, contact lenses, that's all kind of in here. Then your hearing aids are in your hearing services. Remember, these are the actual supplies, mostly in this book. And then you have your Appendix A, which is the policy manual for Medicare services. Probably a really good read, but I don't know that it would do you too much good right now. You might rather read it once you have actually billed. You know more. This might not mean so much. You don't know about the NCCI edits. We'll learn about some of those in the reimbursement process chapter that we go over. I would recommend you just wait and put it on the list that sometime you need to come back and read this, because I don't think it would do you too much good now. It's a whole lot of mumbo jumbo for right now. Eventually you'll probably need to read it, especially when you're out in the real world, billing for the real world. So that is the HCPCS manual in a nutshell. Not too hard. You should be good to go with this. For the purpose of the board, some of your easier questions will come out of here.